Hi class, welcome again to another session on biomaterials. So today let us discuss the ankle joint, and if time permits we shall discuss the elbow joint as well. So the ankle is a very complicated joint, one of the most complicated and most stable joint in the human body because it is a weight bearing joint, right? It bears the weight of the entire body. Ankle joint basically consists of three bones: the tibia, the fibula, and the tarsal bone, talus mainly. Then this joint has three articular surfaces. First one is between the distal tibia and the superior surface of the talus. The second one is the medial malleolus and the medial side of the talus. And the third one is the lateral malleolus and the lateral side of the talus. The primary movements by an ankle joint are dorsiflexion and plantar flexion because it's a hinge joint. But it does allow rotation up to 14 degrees. Any rotation up to 14 degrees is considered normal for an ankle joint. So, ankle joint, although it is a hinge joint, it's not a perfect hinge. So, it does have a rotational movement similar to the knee joint. At the same time, it has a gliding movement as well. Therefore, it is very hard to have an implant that mimics the actual ankle joint, right? But we have reasonable substitutes. So ankle prosthesis can be either incongruent or congruent ankle prosthesis. Incongruent can either be trochlear, concave, or concave convex implant or convex convex implants. Congruent can be spherical, spheroidal, conical, or cylindrical. So let us just briefly look into these. So you have the trochlear one, and let's just get a pointer at. Yes. So you have the trochlear one here. So there's a small M that lies on the tarsal and a flat surface on your tibia. So you have the concave convex. So there's a convex surface on your on your tarsal bone, and there's a concave surface on your tibia. And then you have convex where both it's like putting two barrels together. It's like how a grinder works basically. So there's these two, they slide on top of each other, they have a rotational slide on top of each other, and that would facilitate the movement of the ankle. So one of the major disadvantages of using incongruent ankle prosthesis is that it has high stress concentration effect, and there is intrinsic instability in your prosthesis. So moving on to congruent knee implants, you have four types: spherical, spheroidal, conical, and cylindrical. So it is basically the change in the articular surfaces, right? So here you have a spherical surface that is articulating between the two bones. Here you have a spheroidal. It's kind of a sphere, but it's not exactly. It's more like an ellipse. Then you have a conical surface, which resembles that of a cone, like slightly resembles that of the cone here. And then finally you have the cylindrical. So this looks like a barrel, the interfacing surface. So these designs are more stable when compared to incongruent knee implant. Sorry, it has to be ankle implants, not knee implants. I apologize for the mistake. So these are like more stable when compared to incongruent ankle implant, and there's a larger contact area, and it induces less stress concentration when compared to the incongruent type of ankle implants. So the materials used for manufacturing ankle joint replacements are generally cobalt chromium alloys with ultra high molecular weight polyethylene. So recently carbon fibers along with UHMWPE is also being used for manufacturing tibial component of these prostheses. Like any other implant, loosening is an issue as far as ankle prosthesis is concerned. Also, there's limited motion. No matter how good your implant is, it can never have the range of movement of a natural ankle. Also, there are mechanical pain, which is commonly experienced by people who are having ankle replacement implants in them, and these are the major reasons for ankle implant failures. Now, moving on to elbow replacement implants. So, elbow is a hinge joint. It performs flexion and extension. The bones that form the elbow joint are humerus, radius, and ulna, and their elbow is also capable of performing polycentric motion. So the distal end of humerus has two articulation surfaces called the trochlea and the capitulum. A typical elbow joint implant is either hinge or a surface replacement implant, and most commonly occurring problem like any other implant is loosening. Also, since there is very limited soft tissue coverage, you can literally feel your bone when if you press against your elbow. So there's quite limited amount of soft tissue available to cover the elbow joint. Therefore, the implant is vulnerable towards infection. There are very good chances of getting the implantation site getting infected. So this is the anatomy of a typical elbow joint, right? You have the humerus, you have the radius and ulna, and then you have the trochlea and the capitulum of the elbow joint. And this is a replacement. You have a triangular replacement. Looks like a conical flask, right? Yeah, chemistry days. So, and this is how an elbow replacement implant would look like. With this, I'm very pleased to say that we have wound up our 4th unit, and I shall see you again with videos regarding the 5th unit, which is testing of biomaterials. See you then.